Hi there, my name is Taseen.
And my name is Celine. Welcome to the Prescription for Progress podcast. We're two medical students passionate about the intersection of politics and medicine, exploring ways to advocate for our colleagues and patients. Each episode, we dive into pressing healthcare policy issues, share stories from those navigating the political landscape, and discuss actionable steps to drive meaningful change. Together, we'll unpack the current events that are shaping healthcare access and outcomes and learn from experts in the field to find ways for people to get involved on the ground.
And in today's episode, we would like to welcome Dr. Kristin Englund and Jen Johns. Dr. Englund is a titan of infectious disease and serving disenfranchised patients, having served as the medical director of the Free Clinic Medical Clinic of Greater Cleveland, as well as the vice chair of the Cleveland Clinic Infectious Disease Department. She has also served as the for the Academy of Medicine in Cleveland and Northeast Ohio, also known as AMCNO, from 2020 to 2021. Jen Johns is an expert in health policy. She is currently the executive director of AMCNO and a professor of health policy at the University of Pittsburgh, while also having served as the director of government relations at Cleveland Clinic. Dr. Englund and Jen, thank you so much for joining us.
It's an absolute thrill to be involved with the both of you, and I have enjoyed working with Jen for over a decade. So thank you for your interest.
Yeah.
Actually, I apologize for I was rude in the intro. Jen, should I refer to you as Professor Johns or something of the sort instead?
No, I'm an adjunct, so you can just call me Jen. That's what my students call me.
And please feel free to refer to me as Kristen.
All right, we'll do our best. I make no promises. It takes a while to wean me out of old habits.
I hear you.
But that said, tell us a little bit about yourself as well as AMCNO. What is your either your individual missions as well as your mission as an organization?
Me.
Yeah, so the Academy of Medicine of Cleveland in Northern Ohio is one of the oldest and largest medical societies in the country. We currently have 7,200 physician and medical student members. And our goal is really to empower our physicians to be advocates for their patients and to protect and promote the highest quality of medicine.
We're super proud of the Academy. We just reached our bicentennial celebration in 2024. So we have been around, as it states, for 200 years. And during that time, the Academy has been extremely involved in the public health of Cleveland, and has been involved in smallpox vaccinations and starting an initial telephone line where patients could call in and ask for questions. I mean, these are back in the 20s. We did the Sabin Oral Sundays, which involved getting multiple nurses, physicians out for over 90 sites to get 90% of Cleveland vaccinated against polio. And it was the highest percentage of any city in the United States. And the Academy got recognized for that at the national level. So, whether you've heard about the Academy or not, you should. There's a good chance that you might be a member of it already if it's a physician, because we do encompass physicians from all of the different hospitals, really trying to represent the needs of the entire medical community and our patients.
Well, it certainly sounds like AMCNO has had a long and rich history in both advocating for patients on the city level, but also on the state level. What does it mean to you, as a physician to lobby? And what role does a professional organization play in facilitating that lobbying process?
I think lobbying is tremendously important in advocating for both our patients and also for the profession of medicine. So often things can happen at a state level and a federal level that we don't know about. You are so busy in your medical school life, and I was often so busy taking care of patients that it's difficult to be able to stay aware and abreast of all the things that are going on in whether it be in Columbus or Washington, D.C. So we really need organizations, whether it be the Academy of Medicine, whether it be an organization depending upon your affiliation. I, as an infectious disease doctor, had the Infectious Disease Society of America, and there are people in these organizations who it's their job to stay on top of some of the legislature that is moving through the different House and Senate structures, and to be able to make sure that the information that they're getting is accurate, which we can certainly talk more about that given the challenges that we've been having with some politics lately. But not only getting accurate information, but making sure that they're really in the best interest. The legislature is written so that it's in the best interest of our patients and also for ourselves. So, whether it's lobbying for, tort reform in the state of Ohio that the Academy did for many years, making sure that, physicians were able to practice in the state of Ohio without fear of exorbitant malpractice lawsuits. There were challenges in other states right around us. Um, West Virginia did not have tort reform. Thus, as an infectious disease doctor, I saw many patients coming up to see me because ID physicians moved out of West Virginia because there was a lack of tort reform there. So, something that sounds that specific and that small can have a grave impact on the well-being of patients as far as being able to find a local OB-GYN, being able to find a local specialist, and having to travel 100 200 miles to be able to find that kind of care. So, certainly lobbying for our own jobs. One of the things that we find is that there's also a lot of um, a lack of knowledge, I think, about the different roles that people play within the medical specialties or within the field of medicine. If you ask most people, do they really understand the scope of practice that a physician's assistant should have and what their background of education has been, as opposed to a nurse practitioner, as opposed to a physician? Most patients don't understand the difference in all of the work that you folks are putting into your medical degrees and then the residency that goes on top of that. So it's important for us to make sure that we're following scope of practice as well, to make sure that our patients are getting the care at the level that they need. One of the issues that came up recently in the state of Ohio was certainly surrounding different uh, trainers at schools that wanted to be able to control concussion protocols on kids in football, and whether a child who is being ruled out for a concussion protocol could be able to go back in and play the game. Um, I don't know about you, but I don't want somebody who's not been trained in what concussions really are to be making that kind of decision on my child and whether their brain should be going back into a game. So again, these are the kinds of things that I was not looking at on a daily basis, but I certainly count on Jen and I count on our legislative committee to be able to look into this vast array of things. Not only that, but also all the various things that are impacting our patients as well. And we need to engage. And thanks to some of the lobbying efforts that we've done, we've been able to engage with our legal friends as well, who help us out and help us to understand the language and really be able to make sense of the lobbying work that we're doing.
So it sounds like basically the organization not only helps you serve as like a conglomerate for everyone's voices, but also bringing everyone's skills and expertise to the table and dividing labor while also still allowing you all to do it, having people who are experts in health policy, such as Jen, help inform the Dr. Englunds of the world, who can also inform the lawyers of the world and have a full-on legislative branch, and everything can work on together to hopefully help to hopefully help patients.
Absolutely right. We count a lot on Jen to be our eyes and ears at the local and the state level, and then she'll reach out to any of the number of members of our organization that have specific needs. When it was the anti-vaccination time in the state, she called on me to be able to go down to the state house and be able to testify there. If it's an issue regarding reproductive rights, we certainly have our OB-GYN and our pediatric folks who can be called on to be able to go down and either in written testimony or in-person testimony, be able to make a real mark and make a real difference and present their expertise. We also collaborate with other organizations, the Ohio State Medical Association, as far as trying to make an even broader voice. For medical professionals. So it's an ability to really draw on a lot of rich expertise to make sure that all of the needs of the physicians are being heard.
I was just going to jump in and say that I think it's really important that physicians and medical students learn to use their voices and realize that the education and the lived experience that you have truly puts you ahead of where most of our elected officials are. Right now in Congress, we have 535 members between the two houses. We have 20 physicians. So that means 3.7% of Congress is made up of people who've been to medical school, which obviously is a small minority. And so I think it's important, especially as we are entering what is unfortunately, I think, an anti-science rhetoric in a lot of our legislative chambers across the country, that physicians and medical students bring the knowledge and the lived clinical experience to Congress to share what it's actually like treating patients, because I think there is a lack of information that has unfortunately become dangerous, especially in terms of public health and vaccination. And so we really try to be that connector between our elected officials and our physicians.
Yeah, you're right, Jen. I mean, I don't think that many politicians fully I mean they can't have knowledge on everything, but if they've got a someone who lives in their district that is particularly vocal on a certain topic, and wants them to bring it into the house. That's one of the reasons why we got into the concerns about the vaccines here in the state of Ohio, when there was the bill that was brought up to basically get rid of all mandatory vaccines. And this was around the COVID time. And I understand the concerns and fears that people had about COVID vaccination, but this bill would have broadened out, not even beyond the science of COVID, but would have removed the mandate for MMR, polio vaccines, tetanus vaccines. And as you can well imagine, that just flies in the face of science. But the person who brought this up, wasn't necessarily someone who knew the science, and was simply responding to the voice of someone who was a constituent and bringing that up. So it was really important to make sure that science got into that into the hands of the people who were making those decisions.
Yeah, I think you touch on a really great point. Only like very like small minority of people in the legislative branch comes from the medical profession, yet they're the ones essentially dictating who gets access to healthcare and who doesn't, and what kind of healthcare they can even receive in the first place.
Absolutely. We see this during certainly all the discussions surrounding, Medicaid expansion. Um, I was, lucky enough to be a part of my former employers. I'm retired, but I used to work for the Cleveland Clinic. So when I'm speaking for myself and for the academy. But at a time when I was working for the Cleveland Clinic, I was able to kind of be a voice for promoting Medicaid expansion. And I had been working not only at the free clinic, but I also put a primary care clinic into a homeless shelter for women, and then was also working, getting primary care into a behavioral health center, series of behavioral health centers. So really trying to understand the scope of medical need throughout our communities, and especially the needs of those who were uninsured or markedly underinsured. So Medicaid expansion in all of those venues was critically important. It was very frustrating advocating as a physician, though. The clinic allowed me to do that, and I went with government relations representation from the clinic, and I'll talk about that in a minute, why that's so important. But in sitting around the table talking to some of the legislators, um, there were a lot of just kind of talking points that they were bringing up, but not, talking about, you know, personal responsibility and issues like that as far as Medicaid goes. And I was at least prepared in one of the conversations because one of the legislators was in the military, and I had a piece of paper that I'd printed off that talked about the number of veterans who were homeless in the state of Ohio, and who were uninsured and unable to access VA benefits as well. And as I slid it across the table, and I let him know that I thought that those veterans probably had shown a lot of personal responsibility when they represented our country in the military, and that maybe this was something that he needed to reconsider when he discussed them. But again, there can be a lack of real knowledge about who they're talking about, and needing to kind of follow the talking points when even looking at something as important as Medicaid expansion goes. Um, I deviated off point, but one thing that I do want to go back to, you're going to have me do this all hour. I'm sorry, but I deviate amazingly so. But when I talked for the Cleveland Clinic at that point in time, I take that back. I spoke for my patients, but through the Cleveland Clinic, it was tremendously important at that venue to make sure that I was speaking with government relations department, and that I was lobbying at that point in time wearing my Cleveland Clinic jacket. Okay. If you were going to be speaking with your jacket and with that representation, you need to clear it through your hospital. All right. That's tremendously important for you, and thinking about as you move forward with that, because if not, that organization can uh, they can come back on you with that. When I put on my academy hat, I have spoken through Jen, and then oftentimes aside from that, I am speaking for me. But when I speak for me, I can certainly speak my voice, but I need to understand that I can't represent myself as something that I have not cleared, and that's important because so much during the COVID time too, I was getting phone calls from news agencies wanting to get me to speak on the part of the Cleveland Clinic, and I needed to contact my media relations people to make sure that everything got cleared through them. I want to make sure that it's important that you use your voice, but you need to use it appropriately, and not that that's saying that you need to limit what you say. You just need to understand how you represent yourself and in what situation. So, keep in mind, speak your voice, write your op-eds, write anything you want, speak anything you want. But if you're speaking for yourself, that's got to be clear. If you're speaking for your organization, then you need to clear that from through somebody else.
Yeah, we've seen how this all plays out in our case for our school. We actually are we're basically informed to we have to put like tape over our school logo when wearing the white coat for anything like lobbying, because we can't have our school be politically involved in any way. But I wanted to dart back to something just because like there's so many pressing things, and you guys mentioned this earlier, and I want to hear obviously both of your perspectives. Um, right now, vaccines seem to be a massive topic of contention, right? Like you mentioned the legislation that was passed, that was proposed in Ohio. Jen has mentioned it as
Not
well, and
passed.
evolving the landscape. Yeah, not passed. I have to catch myself there. And so I wanted to take a second to evaluate, like to hear from your perspective. What do you guys see as like the primary drivers behind vaccine hesitancy?
Well, um, this goes back for over 100 years, longer than that. I mean, I think there are some folks who are going to question the science and some of the and some of the information that's out there regarding all forms of medication, but we can go back to a Jacobson ruling from the Supreme Court, which was back in the early 1900s, where there was a smallpox outbreak. And at that point in time, it was a ruling for public health measures that everybody had to get vaccinated for smallpox, or they had to pay a fine. And Jacobson said he didn't want to. He didn't want to get vaccinated, and he refused to pay the fine. This went up to the Supreme Court. It was ruled that it was in the public health interest that he get vaccinated, and I think ultimately he ended up paying the fine. But so there's a long history of precedent for public health issues that we need to appreciate the public health, and we need to appreciate the importance of vaccines. Um, you know, over the years, there have been many concerns that have been clearly scientifically proven wrong. That there was concerns that vaccines led to autism, and you know, my God, we don't need to go over this again and again and again in the science, because it's been shown that the article that was in the Lancet, and oh gosh, Wakefield, I can't remember what year it was, but um, the guy fudged the science, completely fudged the science about autism. And that has been proven time and time again that this was wrong and that vaccines do not lead to autism. We've seen a rise in autism over the last few decades. Is that because we're diagnosing it more? Is it, because we're able to make the diagnosis more easily? Is it due to other factors? We don't know, but it is not vaccines. Vaccines have been shown over the last 50 years to save, I was looking it up in the World Health Organization. So at least 154 million lives have been saved over 50 years. And since the measles vaccine came out in 74, 94 million lives have been saved due to the measles vaccine. So do we follow the science of what vaccines have done? The World Health Organization has called it the single greatest contribution of any health intervention to ensure that babies make it to their first year and that they go on to lead healthy lives. So the single most important innovation. Um, that's so important, and I think people who just willy nilly are willing to throw that science away um, have been blessed to live in the times right now that we live, where we are free of seeing measles. I have practiced infectious disease for, I don't know, almost 40 years, 30 years plus, and I've never seen a case of measles. I've never seen a case of measles. Isn't that crazy? And if I was down in Texas right now, I would be concerned about seeing cases of measles. We shouldn't be dealing with it at this point in time. So there's a lot of widespread misinformation about it. I think there's certainly this idea that we want to be able to, you know, take care of our own health, take control over our own bodies. And I get it. But we live in a world with other people. And as a result, we have a responsibility to other people, and that's called public health. And the concept of public health has been absolutely gutted in this country. And that's a big concern that I have. And I think all of that plays into the role of vaccine hesitancy.
Yeah, so it seems like vaccine hesitancy has been going on, like you said, for 100 years or now. But thinking about like the past decade and especially post-COVID,
Mm.
how have attitudes changed, like both in like the clinic, but also in the news?
So again, I think so much of it was revolving around misinformation. The vaccines. Thank God they were created as quickly as they were because again, it saved millions of lives. The mRNA technology was not pulled out of thin air. This was not brand new. It had been looked at for decades at that point in time. I was as part of looking at HIV vaccines. mRNA vaccines were being looked at for that. HIV is a tremendously more complicated virus than COVID was. So it didn't work. That technology did not work for HIV. But it's not as if this was brand new science. It had been looked at and it just had not found the right vector. And COVID was. So the technology was there. They were able to use it in COVID. It hindsight is so 2020. It is so easy to look back at that time and judge the decisions that we made in science at that time. We had never experienced a pandemic like that in our lifetimes. The last time was in 1918, and we didn't have vaccine technology at that time. And we look at the devastating deaths that caused around the world. We had devastating numbers of deaths, especially if it was a person that was close to you. But we didn't have the scope to nearly what we had had 100 years before. Um, I think there was a lot of questioning about how rapidly things were coming out. The mandates came out pretty quickly about mask mandating. Things got closed down. People's lives got changed dramatically. I totally feel that. Both of my kids were in college at the time, and they had their college lives disrupted dramatically. And I think we're going to see the effects of that for decades to come. But I look at the fact that my kids are alive. And that to me is the number one priority. If you did not lose somebody to COVID or did not have somebody really harmed by COVID, bless you. But at that point in time, you may not be in a position to really understand the importance of the COVID vaccine. Because for those of us who saw death after death after death, and the hospitals getting packed to a frightening level, and oxygen levels running low, and we took we I the power ups in the clinic, but took the medical school building, the Case Western's medical school building, and transformed that into a makeshift secondary hospital. They were ready for 500 beds for patients who needed oxygen, not acute medical care like in our ICU, but they were ready for that in case the tide didn't turn, and we just didn't know. So I think people have to understand that decisions are made at a time of um, absolute critical import, and you make the best decision that you can at the time, and you move forward. And I think there were a lot of people making the best decisions that they could in the middle of a crisis. And if you want to look back on that now, then do that. Okay. But make sure that then you're part of the process moving forward. You can't just complain about it and sit on the sidelines. If you want to come down to the hospital and walk around with me, and I'll show you the people in the intensive care unit, welcome. Come on with me. All right. But, I think a lot of people were sitting on the sidelines making a lot of judgments and typing about it on their computers from the safety of their homes when the rest of us were on the front lines.
Yeah, it's my friend and I were reflecting on this recently. Not even, mind you, this is someone who's not even in healthcare, right? And we were on the very morbid discussion topic of what were like the 10 worst like global events since
Mhm.
2000. And we ask our buddy ChatGPT for input on many such things. And it put 9/11 higher. And we were talking and we were like, dude, COVID was a 9/11 every day in terms of deaths. And sure, like during then you kind of had to like stuff it down and normalize it. And it was a different beast when you were on the front lines versus when you were sitting at home. But nonetheless, it was a something of immense magnitude. And if there wasn't a vaccine, it would have been significantly, significantly worse. But unfortunately, I think to the points that you brought up, those whether we may feel different ways about the validity of it, but those keyboard warriors that you describe, or people in between the keyboard warriors and us, right, who are shouting from the rooftops to please get vaccinated. Um, for instance, like I had a coworker who was very hesitant about the vaccine because they saw people develop respiratory symptoms, right? And maybe it's a bit of confirmation bias, maybe it's not. And then obviously there was the matter of how I know there's the folly of hindsight's 2020, but the shifting mandates, the rush, etc. It did a number on the reputation of public health. I think that's something we can all agree on. So, a question I have, getting back to actually your last point, I also have a tendency to meander verbally. Um, how do we win patients back? Because it used to be pre-COVID, most patients, 95 plus percent, or would like sign up would take the MMR vaccine without question. And then now it's, ooh, I don't know if I trust this. I don't know if I trust that. For what you mentioned regarding autism, right? How scientific studies have rebutted it since. An argument that I've gotten from some of my more hesitant family members or family friends have been, oh, but the scientists are all paid off. They're all in on this. So how do we win the trust of patients back?
Wow, is that a tremendously difficult question that we're all going to have to answer moving forward? And I do think
Sorry.
that, oh my God, no, it's great. This is something that I'm retired. You guys are going to have to deal with it. No, 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 no.
Yeah.
I'll be continuing to work on this because it is tremendously important. And I think for a period of time, it might get difficult. And there's going to be a period where a lot of things in science, where we have clear scientific data, um, is going to come into question. It's already coming into question. And there are going to be folks pushing things that have no scientific validity, but sound really good, right? Wellness and supplements and a lot of things that are vague and that don't necessarily have any science behind it. I mean, come on, supplements? You can sell anything that you want in a supplement. I could put black pepper in a pill and sell it as a supplement and make any claims that I want because supplements don't have to go through the FDA. So if I want to get a prescription medication, it's gone through studies. Even the COVID vaccine went through studies. Okay. It got moved out rapidly because we didn't have a choice. We didn't have 5-10 years to make the studies necessary on that. But there are a lot of things that are being promoted now that have no scientific basis behind them. And I don't mean to sound like a total Debbie Downer, but I think people are going to have to go through a period of realizing that those don't work before they get back to real science. Um, at the clinic, I also started a long COVID center because we were seeing patients with COVID having a number of years of symptoms following that. Um, and unfortunately, like folks who, may have symptoms of chronic fatigue syndrome, which is similar to what a lot of patients with long COVID had, they were falling prey to these wellness centers that were popping up that were promising, you know, ozone treatments and stem cell therapies and hyperbaric oxygen that had no proof, that were not covered by insurance, and also diets and supplements and different things that patients just wanted to feel better. So they were going to listen to these statements that were being made by these wellness centers. Of course, you're desperate. You want to feel better. And regular medicine, we didn't have that magic pill. We didn't have the all-encompassing answer for them. So they're going to go to these centers and unfortunately spend a lot of money, not covered by insurance, to not feel better. So, hopefully, most people have not lost faith in our conventional medicine. Hopefully, we will all develop more faith in public health because we're going to need that for the next pandemic that occurs. And we need to rebuild that infrastructure. It's kind of more gone the way of private companies and private hospitals. But I do think there's going to be a period of time where people have to live through their own time periods of trying things that are not proven, and not get the benefit from that and spend a lot of money before they come back to us and the conventional medicine.
Yeah, it is. So
How's that
basically,
for negativeness?
I mean, I think that it's perhaps a nicer way to put it is practicality. I think that, people are at the end of the day, and we're seeing this in electoral results, we're seeing this in the way people operate. People care about results. You see results, you say, okay, this works.
Yeah, I think like we say in my business, all politics is local. And I think that this conversation has to get more local again. I think that, when we look at the data, while most people might be hesitant to trust the healthcare system, most patients still trust their individual physician. And so, how do we make sure that it's their personal physician that's having these conversations with them? We're doing a lot of work with the American Academy of Pediatrics so that, especially with our youngest children who we know vaccines are so critical for, how do we have these conversations in a meaningful way where we can rebuild that trust with the patient and really, answer their questions and have an open dialogue? And I think bringing it back to that local trusted relationship is key, because there is so much incoming, as we all know, on the internet, and the misinformation spreads so quickly that it can be hard to point someone in the direction of a peer-reviewed study when they might not even appreciate what a peer-reviewed study is, on a 30-second TikTok video. And so we know that the most important time that we have their audience is when they are in front of us as physicians. And so I think it is critically important that physicians take the time. And I know it can be hard, and there's a lot of things to address in a short visit, but we have to rebuild that back into the conversation with the patient directly.
Absolutely. That one-on-one conversation with a patient, I believe, is like the most powerful thing we can do as physicians to help regain trust. And just based on my own experience in clinic, there are patients that I go encounter that are initially very mistrustful of me, but the more I sit down with them, try to hear what their concerns are and come from like a non-judgmental manner and try to present information in an easily accessible way, they're able to become a lot more open in how they approach like their own medical care and become open to a lot of these interventions that we're recommending that are scientifically backed.
Yeah, relationships in medicine are absolutely critical. You're absolutely right. It's the beauty of having a specialty that I had with some longitudinal patients that we could really spend, they knew me. I could tell them that, I'm prescribing this medication. I have no affiliation with the pharmaceutical company. I think they have to be able to trust your voice and your expertise, and understanding that it's really coming from an interest in their health, and not any other backing behind it.
Really quickly, I want to take a second to hit some of these thoughts that patients often bring up, or patients bring up, or people have brought up in like, you know, I guess in social settings regarding, I know that you said that you don't want to go over vaccines and autism again. So I'm just gonna we can just go kind of rapid fire on some of these concerns and hash them out instead of, you know, the usual, well, no, but it's science. One thing I've seen that a lot of people are concerned about, and this I've seen both like in clinic as well as personal life, kids getting a lot of shots at once. It scares parents. What do we say in response to that?
Yeah, having had kids and watching them go through getting shots, I felt as traumatized as they were when they were, just teeny tiny little things and getting all of these shots. But I think one of the things we need to realize is that um, there's certainly some vaccines where we get protection from mom's antibodies until they're about 6 months old, but there's some where they're not protected against that. So we need to offer them that kind of protection early on. We also need to look at the schedule of kids. Do we need hepatitis B protection that early on when it's often considered a you know a an infection that really only people who use drugs get? Well, we have to understand that hepatitis B is also passed through sexual transmission. So, are we going to make sure that we get our kids vaccinated against hepatitis B when they are, 10 years old, 12 years old, before the time when they're becoming, sexually active? So I think we try to get vaccines in as early as possible based upon when the child's risk is going to be. Also making sure that we understand their immune system and how they're going to be able to respond to certain things and when they need this protection, when mom's protection is going to run out. Um, and then understanding that when, you know, sometimes kids just don't get back to get their vaccines. We want to capture them when we can because it does take time away from school. It takes parents away from their work to get kids in for their pediatric visits. And certainly as you start getting into 10, 12, 14 years old, most adolescents don't go in for pediatric visits. So we really need to make sure that we're getting those kiddos their vaccines when we get them. HPV vaccine, most parents don't want to think their kids are going to be having sex until they're married. But we know that doesn't happen. So we need to get the HPV vaccine in them before they become sexually active. I mean, it prevents cancer. Hepatitis B and HPV are cancer prevention methods. They shouldn't just be looked at for, you know, because they're sexually related that we need to worry about encouraging kids to have sex. We can prevent cancer with these, and that's how they need to be seen. So if patients or parents want to try and spread out the vaccines for their children when they're young, they need to work with their pediatrician and they need to make sure that they are listening to the advice of, and of when they need to get them. And then also they need to make the commitment to bring the children back in a timely fashion so that the actual vaccine series do get completed. So I think most pediatricians would be more than happy to work with families that have concerns about the bulk of those being given. Um, but then that's the responsibility of the parents to follow through.
Yeah, I think honestly, I'm going to take what you said. I'm going to share it. I'm seeing a lot of family friends next weekend for Eid, and I'm going to be sharing it with those when this conversation comes up. So thank you. Um, the other thing that often gets heard is contents of vaccines, and then this ends up getting freaked out because people see in YouTube videos like there's mercury in vaccines, and I don't want to put mercury in my kids. Can you comment on that really quickly?
Yeah, I think one of the concerns was with the MMR vaccine was the potential for thimerosal that was involved with that. Thimerosal was never in MMR. So again, this is all misinformation that happens. There has not been any mercury in vaccines since 2001. So that has all been completely removed. Um, I think it's important to always look at the vaccines. Was there mercury in vaccines before? Yes. Has that been shown to be involved with autism? Again, that's not science that's been proven. So we need to look at the benefits of the vaccines, and we also need to continue to look at the science behind it and see what the effects of any additives are that are in vaccines. Those are good questions, and the science needs to continue moving forward. But that shouldn't keep you from getting the appropriate vaccine. So again, there's no longer mercury. Thimerosal is in a limited number of vaccines. I believe there's some in our influenza vaccines, but you can also get thimerosal-free influenza vaccines as well. So it's a matter of trying to make sure that our public understands, that they understand that we continue to look at all of these factors in studies. And if there is a concern, don't just say you're not going to get the vaccine. Then talk to your provider about the alternatives and the thimerosal-free vaccines out there.
I think that really highlights a stark contrast between vaccinations and supplements, whereas like the vaccines are very heavily tested, we know what's in them, whereas supplements are pretty much a wild west. And
Yeah.
our HHS secretary, RFK Jr., during his confirmation hearings, uh, very famously is a proponent of supplements over vaccinations, specifically recommending vitamin A and cod liver oil in response to the current measles outbreak in Texas.
Yes.
Yes. I know that AMCNO recently released a statement on the confirmation of RFK Jr. If Jen, you want to briefly summarize what that is and what we're doing as like a physician professional organization to help, uh, I guess, manage some of the new rhetoric of the current
Yeah,
administration.
absolutely. So I think when we think about health policy, we often immediately think to the legislative branch. So we think about Congress or we think about our state houses. And obviously, a good amount of health policy does occur there. But the most health policy that happens in the United States happens within the Department of Health and Human Services. So we are talking about the largest epicenter of healthcare policy, of public health policy for the nation. And so when we think about putting somebody in charge of that agency who has no medical training, who has no public health training, that's incredibly dangerous. And I know for the leadership of our group, we felt strongly that we needed to speak out. There are certain times when, even if something can be perceived as political, it's still the right thing to do. And I think, the significant downstream impacts that we're going to see by having this individual running the agency are going to be felt for generations. And I'm glad that we stood out against it. We're very concerned about his anti vaccine views, of course, but just in general, his lack of education and training in this field, for him now to be seen sort of as the expert in the country is quite frightening.
Absolutely, Jen. I think the statement that Dr. Schaefer made as our president was very important in denouncing his nomination before he was approved. So we are very grateful for both of your leadership with regards to that. It's unfortunate. I think and it does sometimes go to the politics of it. There are some organizations that are medical organizations across the country that were unwilling to make that kind of a statement. And I think it's important, again, we go back to advocacy, that we as physicians make sure that these associations are really looking out for medicine, the field of medicine, the respectability of the field of medicine, the physicians, the patients, and not necessarily trying to walk a political line. So I think that's something where we can get some grassroots voices and make sure that we sign petitions and that things are sent up through our medical associations so that they understand what we want the voice to be. rather than what a group of people sitting in a room at the top think our voice should be.
You just brought up something that is a personal, and I don't know if this is because I'm young. I don't know if this is because of my personal views. Um, it's a pet peeve of mine. This like, and I think that there's, to my observation, I think that there's a bit of a culture gap in here, and I'm curious to hear what you both have to say on this because a lot of times you hear like, oh, like, you're doctors, not politicians, right? You're not studying politics, you are studying medicine. Stick to what you know, stick to the science, right? Don't pick a side, don't stray from neutrality, right? But then on the other hand, you see science, especially in the post-COVID world. I think that like my counter argument in these discussions has often been when you're talking with a patient about having a vaccine, all of us have had these conversations in some way, shape, or form. Like I worked as a medical assistant before med school, by the way. So I used to
Good
have
for
like,
you.
no, so it's not a brag. I just used to, basically, I used to have these conversations with patients with none of the deference that the doctor usually gets. I had a patient once like try and throw hand. It was hilarious and scary. But um, but basically, you're having a political conversation at work every day, whether you realize it or not. And the way things go, they are becoming increasingly politicized. So, how do you navigate and how do you suggest to people in my and Celine's shoes to navigate this world where you have some who, and this is both in the worlds of politics and medicine, some who are beholden to these old rules, these old standards, and others who are alarmed by these developments and would rather not have measles, which was supposed to be eradicated in 2000, popping back up in droves.
Oh, this is going to be an interesting road for you both to walk, and all of your colleagues as well. I think if you keep the patient in the center and you surround them by science, and then keep your professionalism around that, the decisions that you make um, can't be deemed political because you're looking out for the patient and science. And I think we all want to try and do what's right for our patients. That's why we went into the field of medicine, right? I mean, I'm not beholden to any pharmaceutical company. I'm not, my politics may be in a certain direction, but I do my best to not let that change my medical decisions on people. It may change where I put myself. I think it made me want to look at people who are homeless and look at people who are mentally ill, and work with my HIV populations where people from another political party may not have put themselves in that positions. Um, but I don't think that drove my medical decisions for the individual patient. So I hope that people are able to see that. So I may be arguing for Medicaid, but that's because I've worked with that population, and I understand their needs. And somebody on the other side of the aisle may not have had those interactions that I've had to be able to try and understand what the individual patient's needs are. So I, it, I'm probably not putting this very well, but I think as long as you have your core value, your patients, and treating them with the best medical science that you can, um, you're always going to be able to stand on that ground. Um, I was probably a lot more politically incorrect earlier in my career. Um, and I did learn through the Medicaid expansion process that I needed to try and couch a little bit of my um, a little bit of my arguments and my discussions, to making it so that I was less, how do I put this, less less speaking from a passionate standpoint and more speaking from a scientific and a logical standpoint. It was very easy for me to go into a room and speak about the patients that I was seeing, and that was not moving or swaying people who were seeing it from a different side. As a matter of fact, they would, after a certain point in time, I was allowed to leave the room and they would continue the conversation with the government relations person that was with me, who was a lawyer. So I got ticked off by being asked to leave the room in a broader sense, and ended up going down to Cleveland State and getting a master's in legal studies because I wanted to be able to speak the language of the politicians and not be dismissed from the room. So you can't take away um, my medical knowledge or my medical passion for my patients because you think I'm not smart enough and that I'm just a passionate liberal. I can speak to you on your level as well, but then you have to appreciate where I'm coming from. Does that make sense?
Yeah, that completely does. I think that it's such a difficult line to walk, right? Finding this balance between showing and channeling emotion while also not a complaint that I've seen levied in, public facing scientific or medical officials of seeming cold and heartless, right? There's a fine line to thread and it changes based on the situation. And it seems like in your case, you had to veer it more towards like the cold analytical side, which can hurt. I too run warm-blooded. Um, so we have taken up so much of your time, and we really, really appreciate you guys spending this time with us. We wanted to close off with the giving both of you the floor, to share one call to action, one thing that you really want us or listeners to do or pay attention to. The floor is entirely yours.
So I'll start off. I will congratulate the both of you for starting your advocacy journey as early as you have. Oh my God, I wish I had been able to do that. I wish I had had the foresight to see how important that is. So, congratulations to you all, and I hope your colleagues learn from that and learn the importance of what you can do even at a younger age, whether it be starting in college or certainly with you folks in medical school. But one of the things that I think we can highlight through the academy is, and Jen can speak to this as well, we too appreciate a variety of opinions and the younger generation's voice. We are not an organization of people 60 and above. We have a Future Leaders Council, and it is for medical students and residents and fellows. And to not only get the experience of being on a council, a board, to be able to learn from experts like Jen on the advocacy world, but to be part of the legislative committees. So we have future leaders on all of that to try and understand that they can make a difference at any stage in your career. So take a stand, make a commitment, and make a difference. So, Jen, I'll leave it up to you.
Or I think what I hope, especially when I talk to students, that they walk away with is that the only way that the bad guys win is by us refusing to be a part of the process. And so, I know bad can be a subjective word, but when you're looking at policy and you see things that you don't like happening in the world, the only way to change it is to show up. The quote of "We are the ones we've been waiting for." No one is coming to save us. We need to save us. If we don't like the way that the government is functioning, it's on us to get involved, to have those conversations. And I hope that what I do in my role, and what I'll hopefully continue to do the rest of my career, is really empowering physicians to take the oath that they make to that patient and bring it into the world. and to protect the health of the world as a whole.
That's fantastic. And on that note, we'd like to thank you both for being on the show.
Thank you for having us.
Absolutely. Thank you, and good luck in both of your futures.